All right, so let's take you to this now. The Western Cape Department of Health and Wellness is urging the public to be cautious this festive season while they encourage people to enjoy their holidays. Many incidents of injury and death could be prevented by responsible behaviour. Preparing for months, it says it's ready for a busy December at all its hospitals, among others. SABC News reporter Mariska Botha spoke to the emergency medical services as first responders about their preparedness.
We're coming to you from the Red Cross War Memorial Children's Hospital, where the Department of Health in the Western Cape have today announced their readiness plan for the festive season. Now that stretches from 15 December to 15 January. And we've heard some staggering numbers that was given to us a little bit earlier. Last year, 120,000 visits to trauma centres, in other words, your emergency centres and so on. So it places a huge strain on the health services in the province over this period, and people in general have been asked to please be responsible, especially on the roads, especially with the consumption of alcohol, and to make sure that you look after your children. That is vital. But in case there are emergencies, and inevitably there will be, the people who are on the front line, of course, is the emergency medical services, the EMS as they're called. And we're going to speak now to Craig Wiley. He's from the department's emergency medical services. So, Craig, thank you very much for your time. You're always very busy. First of all, if there's an emergency on the road, what do people, or not just the road, anywhere, who do people contact? How do they make contact with you?
Okay, thank you. So, firstly, I think the most important part is to stay calm. We will come help. But you do need to stay calm and make the first initial call. So the call needs to be to 10177 or to 112 on your telephone, on your cell phone. Importantly is to give your name, your contact number where we can call you back on, and also the location where you are. After that, the contact center operators will ask you some questions to determine the exact emergency that you're dealing with and how quickly we need to get an ambulance to you.
And then, Craig, talk to us about numbers and statistics. How many of your personnel is out there over this period? And what does it take from the staff? Shift you work, all of that, because it's a difficult period.
Thank you. Yeah, so as you know, the Department of Health and Wellness in the Western Cape has got approximately 34,000 staff members, of which some of the staff members are clinical staff members and some is administration to support the clinical staff members. In the Directorate of EMS, or Emergency Medical Services, we've got roughly 1,548 at the moment emergency care providers that provide clinical care on the front line to our patients. What was your second part of your question? Sorry, I forgot.
I'm talking about shifts. How does it work when you work over this festive season?
100%. So that 1,548 staff members at the moment work 12-hour shifts, and they work around 14 shifts in a month of 12 hours each, and those shifts will change as the month goes along. A lot of them will be on standby on their off-duty time for when a disaster, major incident does hit, so that they can come help. Specifically speaking to the stations that's on the major national routes coming into Cape Town, into the Western Cape during this time, a lot of our staff will be on standby for those big taxi accidents. We've had our first bus accident on Sunday, as you know, tragic event. But we were able to respond quite efficiently to that and send resources also from the central spaces to go and assist out there.
What are some of the most incidents you see while you're busy working?
So thank you. I think that during the December period, specifically during this 15th of December to 15th of January, we see a change in our workload, where normally we've got about a 40-50% or 40-60% split between interfacility transfers and public calls or public emergencies. We now see a more towards the 50-70% split towards the public emergencies. And obviously that comes with increased risk, it comes with increased or decreased ability to respond, because interfacility transfers we can plan quite well for, where the public emergencies you can't. Yeah. What we see, everything from stabbing, shootings, cardiac events, medical events, to accidents and severe accidents. In the Western Cape, specifically the public service, we do see a larger proportion of penetrating trauma than blunt trauma, and it just speaks to our population size and the social economics of our population in the Western Cape.
What is penetrating trauma?
So anything from stabbing, shooting, anything that pierces the skin, essentially.
And then you're also making use of motorcycles. Explain that to us.
So a motorcycle is not a transport vehicle, so it's not an ambulance, but what it is an ability for us to get to a patient quickly in a very populated area. So as you know, if the traffic in a specific area, such as the Strandfontein beaches on New Year's Day, you can't drive anywhere with your normal motor vehicle, but with a motorcycle we can get through the traffic, we can get to the patient, and we can intervene and hopefully save a life.
And lastly, maybe just your call to the public.
My call to the public, be responsible, be safe. If something goes wrong, stay calm and call for help.
Thank you very much. That was Craig Wiley speaking to us of EMS services in the Western Cape. You heard him. Make the call, stay calm, but be responsible. We've heard it over and over.